Hello friends and welcome to the last episode of Smoke Your Greens. We'll be getting into the specifics of how cannabis can help those with AFAB reproductive organs. First things first, we need to talk about a system that all humans have, the Endocannabinoid System, or ECS, because y'all know me at this point and I can't be trusted to say endocannabinoid every single time. ECS regulates everything from body temperature to immunity, digestion, and reproduction. The ECS involves three core components. We have endocannabinoids, receptors, and enzymes. Endocannabinoids are molecules made by our body and they're very similar to cannabinoids. Remember when we talked about those with Bud Tender Carl? Endocannabinoids are produced naturally by your body. The receptors can be found throughout your entire body, and the endocannabinoids bind them together in order to signal to your ECS system that it needs to take action. There are two main cannabinoid receptors. We have CB1 receptors and CB2 receptors. CB1 is found mostly in the nervous system, while CB2 is found in your peripheral nervous system, which includes immune cells. This system will then respond to your body by synthesizing and creating those endocannabinoids on demand. Those endocannabinoids then bind with cannabinoid receptors, triggering a series of chemical reactions that bring functions and balance to run optimally. So the thing is, your ECS can become deficient in endocannabinoids, and this can cause dysregulation, leading to imbalance in the body and eventually cause health issues. Now, the cannabinoids that are derived from cannabis can serve as a supplement to your body's own endocannabinoids, helping to ensure the ECS perform its regulation duties effectively. We're going to get into the uses more specifically, but just a few quick examples. Research shows a well-operating ECS can help suppress mood swings during menopause. Cannabis may help bolster the ECS's abilities to keep functions balanced, reducing the risk of depression in those experiencing mood swings in menopause. A recent study on chronic pelvic pain saw that 100% of patients using cannabis to treat their CPP had a clinically meaningful 5.9-point reduction in pain score. Okay, so getting a little bit deeper into it. According to the U.S. Department of Health and Human Service offices on women's health, 1 in 5 women in the U.S. has a mental disorder such as depression, anxiety, or PTSD. So of course these conditions have effects on your overall health and can lead to things like insomnia, migraines, low libido, and gastrointestinal distress. Okay, so it's found that the pelvic organs have a high density of cannabinoid receptors, so the things that those endocannabinoids latch onto to let the body know that it needs to regulate itself. And doctors are finding ways to get right to the source. The fact that the vagina has a mucous membrane that can readily absorb medical products makes it so the suppository is uniquely suited for treating these conditions affecting the reproductive system, as they target the issue right at its source. Additionally, they noted that using suppositories will not induce euphoria since cannabis isn't metabolized by your liver. One thing doctors have focused heavily on in studying how cannabis can help specifically with reproductive health is looking at endometriosis, which is a condition where tissue that normally lines the inside of the uterus grows in other locations in the body, primarily in the pelvis and near the uterus. The management of this pain has historically been very challenging, and many treatments in this condition are currently hormone-based. Okay, so it's been found that women with endometriosis have lower levels of the CB1 receptors in their uterine tissue. Inferior receptors and decreased activation of these receptors may lead to worsening pain. So therefore, increasing the binding to these receptors is of importance in potentially mitigating endometriosis pain, making cannabis a promising treatment option, because remember, we can get those sort of pseudo-cannabinoids into our system through cannabis and through CBD. Like we spoke about in the last video with Ashley's case, her medicine doesn't use any sort of THC, it's only CBD, so there's not going to be any psychoactive effects from that. This is a quote from one doctor. "We see so many endometriosis patients using cannabis in a variety of forms for their symptoms," she says, noting vaginal suppositories are hugely popular for treating symptoms. Like I mentioned earlier, menopause is another condition that the symptoms can be treated using cannabis, or CBD. Research exploring the benefits for menopause in women is scarce, but scientists and medical experts do have a modern scientific understanding of how cannabis could be useful. The endocannabinoid system and estrogen are very closely linked, and some preliminary research even suggests that early onset menopause can be related to deficiencies in your endocannabinoids. One doctor describes menopause as an array of conditions that affect the body based on lack of estrogen. THC or CBD are not going to help with that hormone, but they will help with the symptoms. If a patient comes in saying they're having bad days, migraines, mood swings, temperature fluctuations, all of these things can be controlled, dulled, and helped with the use of cannabis-based medications. My mom would love to hear this one. Research suggests that THC can lower body temperature, which could mitigate hot flashes. Those who bleed once a month know that dealing with PMS is no walk in the park. But what could help are some trees. That was so corny, but I'm leaving it in. So symptoms of PMS and menstruation can include cramping, mood changes, migraines, nausea, and other issues. Fortunately, cannabis has the pain-relieving, mood-stabilizing, and anti-nausea properties that can help alleviate these symptoms. Using cannabis may also help menstruating people treat or relieve diarrhea and the gas-related sensations in the stomach. Research into cannabis for period-related symptoms like diarrhea is lacking, but medical marijuana is commonly recommended for those with IBS, which is a long-term disorder that causes bloating and diarrhea. So doctors can assume that it'll help you as well. And lastly, and obviously the most fun, sex. Another study found that routine cannabis consumption was associated with improvements in female sexual satisfaction based on all measures, including level of desire, arousal, lubrication, and orgasm. Another study from the Sexual Medicine found that nearly 7 of 10 women who used marijuana before sex had a more pleasurable experience. Using cannabis before sex also boosted sex drive in over 60% of women, and more than half experienced an increase in satisfying orgasms. I wanted to take the opportunity to use this episode to focus on women's health and, those assigned female at birth health in regards to cannabis and medical research, because every article I found just about said there's lack of research in menopause, there's lack of research into PMS, there's lack of research into endometriosis. And like we talked about last episode, there's lack of medical research in general for cannabis in terms of therapeutic benefits, but there's especially a lack in those conditions that have to do with the female reproductive system. So I think it's important to highlight some of the things that have been found so far, and hopefully we can get more studies done for things that are harming the ladies out there. If you've been on this journey with me from the beginning, thank you so much for sticking through the historical timeline, our dispensary visit, our look into the history of medical research and why we're able to do so now, and now looking in depth at women's and AFAB sexual health and cannabis. It's been great. I learned a lot. I hope you did too. And remember, smoke your greens.